Today's class will discuss about thyroid agents. So what is thyroid gland and what are the drugs, or else we can say what are the secretions of the thyroid hormone. So what is thyroid gland? So thyroid gland is a ductless gland which is a butterfly in shape and is just present below the larynx. And here we can see the location of the thyroid gland, which is having a thyroid cartilage also, and it is present just below the larynx. And here this is the anterior view and posterior view of the thyroid gland. Here there is, it is attached to the hyoid bone and it is having a blood supply of about superior thyroid artery, and it is present, we can say it is just attached to the trachea as well below the larynx, and this is the posterior view of the thyroid gland. So what is the linkage between brain and thyroid? So how does the brain and thyroid are getting connected? So here, if we see from the brain, in the hypothalamus of the brain, so it secretes the hormones like thyrotropin releasing hormone, which aids in the release of thyroid gland secretions, and dopamine, growth hormone releasing hormones, somatostatin, gonadotropin releasing hormones, corticotropin releasing hormones, oxytocin and vasopressin. So these are all the secretions of the hypothalamus gland. So here from the hypothalamus, whatever the thyrotropin releasing hormone is released, it is aiding in the stimulation of the thyroid gland, leading to the thyroid hormonal secretion. And if we see in the thyroid gland, it is releasing two hormones, that is triiodothyronine as well as thyroxine. So let us see the system, or else we can see what is the feedback pathway or else loophole which is going between the linkage of brain and thyroid. So if we see here on the stimulation of the hypothalamus, it secretes the thyrotropin releasing hormone, whereby this thyrotropin releasing hormone, it is aiding in the stimulation of the thyroid gland by secreting the hormone called as thyroid stimulating hormone. So this thyroid releasing hormone, it aids in the stimulation of thyroid stimulating hormone, which stimulates the thyroid gland, aiding in the release of the thyroid hormone, that is T4 and T3. And this T4 and T3, it inhibit both the thyroid releasing hormone as well as thyroid stimulating hormone, whereby it is showing the negative feedback metabolism. Now, what are the hormones which are released from the thyroid gland? So, from the thyroid gland, there are two hormones released. One is T4, that is 3,5,3-5- tetraiodothyronine or thyroxine, which is containing 65% of the iodine in it, as well as T3 hormone, that is 3,5,3-triiodothyroxine, which is containing 59% of iodine. So along with T3 and T4 hormones, it also secretes another hormone called as calcitonin. Here is the chemical structure of the T3 as well as T4 hormones. So it is containing 3 iodine groups in it. So if we see the structure, it is containing 3 iodines at the position of 3rd carbon atom and 5th carbon atom, as well as to the other chain, it is present in the 3rd carbon atom. So as it is present on C3 carbon atom at 2 different rings, so it is represented as 3, 5 as well as 3-. That is the reason, as it is containing 3 iodine groups, it is called triiodothyronine. And if we see T4, it is containing 4 iodines at C3 as well as C5 of 2 different rings. So it is represented as 3-5 tetraiodothyronine, which is T4 hormone. Now let us see the biosynthesis of thyroid hormones. So how thyroid hormones are synthesized in the body. So these thyroid hormones, they are synthesized in the body by various steps. So one is thyroid uptake. It involves the steps of thyroid uptake, oxidation and iodination of the hormones, coupling as well as storage and release, and peripheral conversion of T4 to T3. So what happens? So here from the food what we take, it consists of about 30 to 50 grams of iodine. So out of this, 1/5 of the hormone or as 1/5 of the iodine is present in the thyroid hormone itself, and remaining is uptake from the food. So however, this thyroid gland, it aids in the uptake mechanism of this thyroid, we can say this iodine. So this iodine, once the uptake mechanism of iodine is done, the iodination of these the iodination of this thyroxine takes place, whereby leading to the formation of T3 as well as T4. So first the iodine is uptake from the food as well as through the food what we take. So through the dietary sources, the iodine is getting uptake in the thyroid gland, and thereby the oxidation and iodination of these takes place. So here, once the iodine is uptake, it is getting oxidized with the help of an enzyme called as iodine oxidase dehydrogenase, and thereby it is getting converted to iodonium ion, that is I plus. So once it is getting converted to I plus, thereby it undergoes iodination because extra iodines are added to the thyroxine, and thereby it is oxidized and iodinized, and then coupling takes place. So here the two different thyroxine groups, so these hormones are formed from the thyronin, so these two different thyronin groups, they are getting coupling together in order to form the complete structure of the thyroid hormone, and thereby once these are formed, once these thyroxine, that is T3 as well as T4 are formed, they are stored in the vesicles. So whenever they are needed, they are getting released from the thyroid hormone. And here, once after the release of the T4 hormone in the peripheral, or else we can say in the peripheral area, the T4 is converted to T3. In the sense, deiodination of T4 is occurring. So one of the iodine group from the T4 hormone is getting removed, whereby it is converted to T3 hormone. So now let us see the transport. How does this T3 and T4 are getting transported and metabolized in the body? So here this T3 and T4 hormones, they are getting transported with the help of the plasma protein. So main three plasma proteins, that is thyroxine binding globulin, thyroxine binding prealbumin and albumin. So these are the three main plasma proteins. They are acting as the carriers for the transport of this T3 and T4. So here they bind to these plasma proteins, and thereby they move, or else we can say they are getting distributed all over the body. And this we can say these almost all protein binded iodine is thyroid hormone. So here this thyroid hormone is having greater affinity to all these plasma proteins, and thereby it is distributed effectively. If we see, we can say out of the hormones which are secreted out of the thyroid gland, 90 to 95% is of T3 hormone itself, and whatever the leftover, that is 7 to 10% is of T4 hormone. Majority of the hormone which is secreted by the thyroid gland is T3 hormone, and it is metabolized in the liver with the process biotransformation reactions like conjugation and glucuronidation, and it even occurs a process of deiodination also. So the metabolism occurs through the process of deiodination, conjugation as well as glucuronidation in the liver, and the T half for T4 hormone is about 6 to 7 days, and for T3 is about 1 to 2 days, and it conjugates, as I told you, it undergoes a process of conjugation in the liver. So once the conjugation reaction is taking place, it forms a metabolites, or else we can say it forms the conjugates of the metabolic reaction. So these conjugates, it is excreted in the form of conjugates in bile, and the fraction of deconjugated, whatever the leftover deconjugated hormone is there. So if a hormone is getting metabolized, so it forms conjugates, and whatever the leftover portion which is not metabolized, or we can say which is a deconjugated form of the thyroid hormone, it is getting reabsorbed into the intestine, and thereby it is excreted in the urine. So which are metabolized, they are excreted in the bile, and which are not metabolized, they are excreted in the urine. So here is the pictorial representation in the biosynthesis of thyroid hormone. So here we can see from the blood the iodine is getting uptake. So once the iodine is getting uptake, the iodine is converted to I minus, it is converted to iodonium ions. So once these iodonium ions are formed, it is undergoing, or else we can say it is binding to a protein substance, or else we can say it is binding to a transporter called as pendrin. So here, after binding to the pendrin, it is undergoing the process of oxidation. So once the iodine is getting oxidated, it undergoes a process of iodination. So these are the two reactions which are taking place. First, the oxidation takes place, and the other one is iodination takes place. So once the iodination takes place, the thyroid hormones are synthesized. So they are once they are synthesized, they are stored in the storage vesicles, and after the secretion of the thyroid hormones, they undergo a process of conjugation, and after the conjugation, whatever the metabolites are formed in the conjugation, they are excreted by the process of endocytosis. So here, once after the conjugation, after the conjugates are formed through endocytosis, it is getting absorbed into the liver, and thereby it is in the peripheral, we can say it is absorbed into the peripheral system, and thereby it is undergoing a process of proteolysis. So once the proteolysis takes place, the T4 is converted to T3, and thereby the T3 is entering into the blood. So this is the process, complete process of biosynthesis of the thyroid hormones. Now let us see the pharmacological actions. So how does these thyroid hormones are affecting? So these thyroid hormones, they bind to particular receptors in order to exert their action. So here the various actions, or is what are the various effects which are showed by the thyroid hormones are especially in the growth. They aid in the increase of the growth. So they aid in the development of bones, and thereby they aid in the increase of growth. So that is the reason, if there is any impairment in the thyroid gland, there occurs dwarfism. We can say that the person can't grow in height, and there occurs calorie-genesis. So this thyroid hormone, it aid in the metabolism of carbohydrates, proteins and fats. Thereby the calories are generated in the body, giving the energy. And on the CVS, it aid in the enhancement of, or else we can say it increases the sensitivity of the tissues to the neurotransmitters. So once the tissues are getting sensitized to the neurotransmitters, they get more affinity towards the neurotransmitter, and thereby it shows the better action. So there are various neurotransmitters in the body. So all these neurotransmitters, sensitization towards the receptors is increased by these thyroid hormones. Thereby it causes increased heart rate and increased cardiac output. On skeletal muscle. So on skeletal muscle, it shows, we can say the skeletal muscle, it makes the skeletal muscle weak. So on a skeletal muscles, these thyroid hormones, when act, it causes weak in the skeletal muscle, as well as they increase the tone of the skeletal muscle. So that contraction and relaxation movements of the skeletal muscle will be increased, and thereby leading to a condition called tremor to myopathy. So first tremors occur or seizures occurs, and thereby it leads to a condition called myopathy. On CNS. So on CNS, the overstimulation of the thyroid hormones, it leads to the anxiety, and thereby it causes nervous excitability. In the sense, it causes excitation of the nerves, leading to the anxiety as well as condition called hyperphagia. And on GIT, these thyroid hormones, they aid in the, or else we can say, they increase the appetite. So whoever we can say who are taking thyroid supplements, they feel more hunger, and the food intake will be increased, and they aid in the increased secretion of gastric juice. So these thyroid hormones, once on stimulation of these thyroid hormones, they aid in the secretion. The gastric acid secretions will be secreted more, and it causes the increased motility of the GIT. So the GIT smooth muscle, the smooth muscle tone of the GIT will be increased, leading to the greater GI motility. So in the kidney, it shows increased urine output. So if a patient is having the overstimulation of the thyroid hormone, it leads to the increased output of the urine flow, as well as it facilitates in the erythropoiesis. So in the circulatory system or in the blood, it aids in the erythropoiesis. So erythropoiesis is a process by which the formation of red blood cells takes place. So this thyroid hormone, it aids in the formation of these red blood cells. In the reproduction, the thyroid normal function is required for maintenance of pregnancy and lactation. So if there is any deficiency of thyroid hormones, then it may lead to miscarriage. On metabolism, so as I told you, this thyroid hormone, it aids in the carbohydrate, protein and lipid metabolism. So on carbohydrate metabolism, what does it do? It increases the process called as gluconeogenesis. So gluconeogenesis is a process by which the glucose is formed from the other substances like fats and proteins apart from carbohydrates. So glucose, neo means new products, and genesis. From the new products, glucose is generated apart from carbohydrates, and it increases the glycogenolysis also. So here the glycogenolysis also. The glycogen is getting breakdown into glucose in order to provide energy, as well as it increases the glucose absorption in the GIT. So the absorption of the glucose will be increased in the gastrointestinal tract, as well as it enhances glycolysis. So the glycogen is breakdown to release the glucose in order to have better uptake of the glucose, and the net result is increased blood glucose level. So if the gluconeogenesis process is increased, it leads to excessive formation of glucose, and if there is any glucose uptake, so the increased glucose levels are by various mechanisms. So one is through the formation of the glucose from fatty acids, proteins and all, and the other one is the glycogen is getting breakdown to glucose and the glucose uptake mechanism. So all these aid in the increased glucose levels. On protein metabolism, so it causes the increased protein catabolism. In the sense, the proteins are getting breakdown. So once the proteins are getting breakdown to amino acids, it aid in the better muscle tone. And on fat metabolism, it causes mobilization of the fat. So here it causes oxidation of the fatty acids. So these fatty acids are getting oxidized and they form triglycerides, and they are stored, or else we can say these triglycerides are used in various metabolic processes, and it increases BMR. So once these fatty acids and proteins are getting catabolized and forming the metabolic products, it increases the body metabolic rate. So here we can see the mechanism of action of thyroid hormone. So here this thyroid hormone, that is T4 or T3, once it is entering into the body, it binds to the thyronin receptor, that is TR receptor, and this thyronin receptor, it on stimulation of this thyronin receptor, it leads to the various actions of this thyroid hormone. So here this thyroid hormone, in the sense this after binding to the TR receptor, it aids in the, we can say it binds to the ligand. It binds to the ligand. Ligand is a compound which aids in the formation, or else we can say it binds to the new products to form an active compound. So this ligand, the ligand which is present on the this receptor, this T4 or T3 thyroid hormone, it binds to receptor and it causes the heterodimerization. So it forms the heterodimerization, in the sense it forms the cyclic groups. So where the straight chains are converted to the cyclic chains, causing heterodimerization, whereby it is binding to the RXR, that is the receptor, the RXR receptor, leading to the stimulation of this, or leading to the effective pharmacological actions of this thyroid hormone. What are the thyroid disorders? What happens if thyroid is released excessively, or if less thyroid hormone is released? So if excessive secretion of the thyroid hormone occurs, it leads to a condition called hypothyroidism. And if little secretions of the secretions from the thyroid hormone occurs, it leads to a condition called hypothyroidism. So for hypothyroidism, the thyroid agents are given, that is thyroid supplements are given. And for hyperthyroidism, in order to suppress the action of thyroid hormones, the anti-thyroid drugs are preferred. Now let us see hypothyroidism. So what is hypothyroidism? So it is a condition where the lower amount of the secretions from the thyroid hormones are observed. So here the thyroid hormones, it fails to produce the enough amount of the thyroid hormone. So here once the thyroid hormone is getting secreted lower, it causes low metabolic reactions, and thereby it causes mental and physical sluggishness. So here once the metabolic rate gets slowed down, the person person becomes fatigued and weak and becomes lazy, and it causes retardation of the growth and development. So as the thyroid hormone, it increases the growth. Once the thyroid hormone secretions are lowered, it leads to the retardation of the growth, leading to a condition called dwarfism. And in children, we can observe dwarfism and severe metabolic rate. And here, the most severe form of hypothyroidism is myxedema, that is inflammation to the tissue. Here are the signs and symptoms of the hypothyroidism. Here we can see it causes a poor memory and concentration. There will be psychological changes. The person will lose, we can say he'll have low memory power, and there will be hoarseness in the pharynx. There will be some sort of inflammation conditions in the pharynx. There will be poor hearing. There will be slow pulse rate and pericardial effusion. So whatever the heart secretions are there, secretions, or we can say the pumping capacity of the heart will be lowered, and to the extremities it leads to the coldness. We can say it causes the numbness and coldness in the extremities like hand and feet, and it causes fatigue, it causes the shortness of breath, there will be difficulty in breathing, and various other side effects are observed, or else the sign and symptoms are observed in the hypothyroidism condition. So, what happens if this condition is untreated? So, if this hypothyroidism, if it's not treated and this condition persists for longer period of time, it leads to the condition called as goiter. So, goiter is a condition where there will be abnormal inflammation of the thyroid gland, and thereby there will be impairment to the or else we can say there will be impaired functioning of the thyroid hormone. Thereby, the thyroid hormones will secretion can be stopped, or there will be lower secretions, and it leads to the heart problems. There will be severe cardiac effects, and it causes mental health issues. It causes disturbances in the central nervous system, myxedema, and there will be birth defects also. Now how this hypothyroidism can be treated. So this hypothyroidism can be treated by the thyroid hormone supplements like levothyroxine, that is LT4, levo form of T4, and lyothyronine, that is T3, and Lyotrix, it is a combination of both T4 and T3 hormones. Levothyroxine. Levothyroxine is marketed as L-troxin, Euthrox, Lovoxil, as well as Lovothyroid and Synthroid. So these are few of the marketed preparations of levothyroxine, and this we can say I told you this is a hormone replacement therapy. So what does it do? These are the thyroid hormone supplements whereby they look similar to the structure of the thyroid hormone, and thereby they replaces the thyroid hormone and aid in the proper functioning. The dose, how does the dose is recommended? So this levothyroxine dose is given based on the body weight. So in infants and children, it is required to give more when compared to the adults. So in children, as they are in the development stage, as there will be growth and development in the children and infants, so these require more amount of these thyroid supplements when compared to the adults. And on an average, to an infant, it should be given in the dose of 10 to 15 microgram per kg per day. So based on the body weight, the dose is administered, and for adult it is given in the dose of 1.7 microgram per kg per day, and it is recommended to give once a day. So let us see the pharmacokinetics of this levothyroxine. So this levothyroxine, it is taken 30 minutes before meal. Before having meals, this levothyroxine is recommended to give 30 minutes to 1 hour in order to show better effects, and it is taken for about 6 to 8 weeks. So the therapy of this levothyroxine should be taken for about 6 to 8 weeks in order to show better results. Why this levothyroxine is useful? So why it should be used? So this levothyroxine is used in order to maintain the stability, content uniformity, low cost, as well as lack of allergic foreign protein, and it is easy laboratory measurements of serum levels, long half-life, and once a day dosing. So all these are the advantages of giving levothyroxine. So this levothyroxine, one is it is cost effective, so anyone can buy that product, and stability. So it causes, in the sense, as we follow the dose of this, we follow the therapy of levothyroxine for 6 to 8 weeks, it causes the stable condition of the thyroid hormones. Thereby high, it is leading to the stability of the thyroid hormones and proper functioning and content uniformity. So content uniformity is a physical parameter in order to evaluate the formulation. For the better content uniformity, this is preferred, and it does not cause any allergic reaction. So it is not having markable adverse effects, and it is easily measured in the laboratory serum level. So here, if we want to measure the content of the thyroid hormone also, as the thyroid hormone levels are to be regulated, so these thyroid hormone levels by the if we take levothyroxine, it is easy to measure the thyroid levels by laboratory use itself, and the it is having a T-half of about 7 days. So that is the reason it is recommended to give once a day. So if we take twice or thrice a day, it may lead to the adverse effects, and the dosing is very easy. Just we have to take once a day. So there is no such disadvantage of missing a dose. So if we give thrice a day or twice a day dose, if one dose is missed, there may be the frequency of the therapy may be disturbed. So in order to prevent this, so it is easy one dosing therapy. Thereby, if we there is no chance of forgetting the dose. The other drug is Lyothyroxine. So Lyothyroxine is marketed, it is containing the we can say it is containing the supplement of T3 hormone, and it is marketed as Cytomel and Triostat, and this is a synthetic Lyothyroxine. In the sense, it is a synthetically derived T3 hormone. It is structurally similar to the T3 hormone, and it is almost 3 to 4 times more potent than the T3 hormone, and it is not used alone. So this Lyothyroxine, it is never used alone. It is always used in combinations for better effects. So this because it may cause some sort of tolerance after the dose. So once it reaches certain dose, it causes tolerance. So that is the reason it is not preferred to give long term, and if we use it for long term, it may have adverse effects. So that is the reason it should be not used alone, and it increases the cardiac side effects secondary to the hypothyroid states. So what does it do? On increased doses, this Lyothyroxine, it may cause the severe cardiac effects. We can say the cardiac conditions can be worsened if the dose of this Lyothyroxine is exceeded. So that is the reason it is recommended to give in particular doses only and not alone. So, let us see the uses of these thyroid hormone supplements. So they are used in cretinism. So cretinism is a condition where the physical and mental status of a person can be impaired, and adult hypothyroidism and myxedema coma, as well as non-toxic goiter, thyroid nodule, if there is any nodule formation in the thyroid gland, and papillary carcinoma of the thyroid. So this is a cancer caused to the thyroid gland. So in all these conditions, these thyroid supplements are given.